Spider veins. Well, most of us either have them or we know someone with those small twisted blood vessels that are visible through a person's skin. The veins may be red, purple, or blue, and most often appear on the legs or the face. Spider veins take their name from the striking spider web pattern. And joining us today is Dr. John Wesley to explain who's at risk of developing spider veins and how they can be treated and how we might prevent them. Welcome, Dr. Wesley.
Thank you for having me, Serena.
Now, I want to start by asking, what is the difference between a spider vein and a varicose vein?
Well, spider veins and varicose veins are part of the same process. Spider veins and varicose veins are basically veins that have gotten too large, and because they're large, they become elongated and twisted, sometimes causing pain and discomfort, heaviness, fatigue.
Well, now, where does spider veins most often appear on a body?
Most commonly on the legs, but they can occur on the face and other parts of the body.
Now, are there any differences between spider veins on men and women?
Well, women will have spider veins more commonly than men, but both can occur, and they occur in the same types of distributions in men and women.
Okay. What would you say is the basic cause for spider veins?
There are a number of causes of spider veins. There are hereditary factors. Gender plays a role in who develops spider veins and who doesn't. The type of lifestyle you lead, weight can influence the development of spider veins, and other conditions that may ultimately lead to spider veins, like previous blood clots and things of that nature.
Well, I know I have spider veins, but I want to know, are they harmless?
So they are usually harmless, but sometimes they can reflect a bigger process that's going on in the deeper veins in the system.
Well, what are the first steps if a person does need treatment for their spider veins? What is the first step in the treatment?
So the first step in the treatment is recognizing whether there are significant symptoms related to it. If there are significant symptoms that I've described before, then the use of compression stockings are the most important first step. Now, that and controlling some of those risk factors that we talked about. So if you can stand to lose a little weight, then losing some weight may help. The type of job, if you spend a lot of time on your feet, opportunities to elevate your legs may help. But generally, those conservative measures will control most of the symptoms related to spider veins.
When should I go see you, a vascular surgeon, about my spider veins?
So there are two reasons why you would come and see me. One would be if you felt that your symptoms were not fully controlled with the compression stockings and the other conservative measures. Or two, if you really don't like the way that they look, in which the stockings don't necessarily make them go away. Those would be two reasons why you would come to see me.
Well, now, what are some of the procedures that you might do?
So beyond the use of compression therapy, we generally treat the veins that are not working very well with what we call ablative therapy. That's just the generic term, which is ultimately getting rid of the vein and making them no longer open and susceptible to filling up with blood. For spider veins, because they're really very, very small, that includes injection sclerotherapy, which is injecting a detergent into the vein to cause the vein to scar down, laser therapy, which also destroys the lining of the vein so that it scars down, or actually removing the veins directly.
Now, is this covered by insurance?
It really depends. If you have true symptoms related to spider veins or any other vein insufficiency, and you have initiated and failed a trial of conservative therapy, then insurance companies may consider covering.
In one short sentence, what can I do to prevent spider veins?
There's not a whole lot you can do to completely prevent them, but you can prevent the progression of spider veins by, again, the use of compression stockings, maintaining an appropriate weight, and that's really pretty much it.
Well, that's what I'll try to do, Dr. Wesley. Thank you very much for being with us today. Well, I certainly do appreciate Dr. John Wesley being here and walking me through when I should be concerned about spider veins and how to treat them.